Good afternoon. Today is March 4th, 2022, and this is the Ways and Means Bill hearings for the afternoon. We will begin with House Bill 933 being presented by Delegate McKay. Whenever you're ready, Delegate McKay.
Thank you very much. Good afternoon, Chair Atterbury, Vice Chair Washington, and esteemed members of the Ways and Means Committee. For the record, I am Delegate Mike McKay here to present House Bill 933 as co-chair of the House Study on Economic Stability Work Group, which is a sponsor of this bill, and I have requested a favorable committee report. I'd like to give you some background first. Before the COVID-19 pandemic, the House Study on Economic Stability Work Group sought to identify barriers of economic stability for Maryland working families. The work group held listening sessions in 4 major regions of the state: the Baltimore area, Eastern Shore, Washington, D.C., and a place I call home, Western Maryland. As a result of the listening sessions, 4 major policy areas were identified with the most affecting the economic stability of Marylanders. The policy area were housing, transportation, childcare, and coordinated services. House Bill 933 addresses concerns raised by the Maryland working families about affordability with quality childcare, which directly limits their ability to work outside the home, to maintain employment, and to pursue education and training opportunities for upward mobility. In Maryland, 79% of the children under 12 years old have a parent that is in the workforce. 1 out of 3 families spend at least 20% of their income on child care for one child. Single-parent families spend an average of 35%. Monthly, parents of infants, toddlers face the highest costs of $1,278 as compared to parents with school-age children who spend an average of $855 monthly. According to the U.S. Department of Health and Human Services, affordable child care is defined no more than 7% of one's family's income. However, Maryland has many families that are paying more than 10% of their household just for these child care costs. To address the problem, House Bill 933 provides an alternative criteria for Maryland's child care scholarship program to enable the percentage of the family's income to be considered for eligibility. This is an important first step in addressing economic barriers in Maryland working families. The COVID-19 pandemic highlighted that Maryland working families and a thriving economy depends on the ability of affordable child care, so families can afford to get back to work. In summary, I request a favorable committee from the report for this most important bill. Thank you.
Thank you. And I'll see if anybody has any questions for Delegate McKay. There are other witnesses, but he needs to go back to appropriations and vote. So does anyone have any questions for him? Seeing none, thank you, Delegate McKay.
Thank you, Madam Chair.
Next, I will call Amani Angela Rose, please, for 2 minutes. Oh, you're on mute.
Okay. Good morning. My name is Imani Angela Rose. I'm a center owner and director. I'm also an RN with 30 years of experience. I testify in favor of House Bill 933, and I would like to share why this bill should be passed. I think this is the beginning step in correcting the child care scholarship program for many persons who will benefit from children, families, and providers equally. We are very much behind anything that helps families be able to pursue child care and subsidy or the scholarship for child care. As we know, the cost of child care is very high. We also know that families depend and need child care in order to work. Our economy needs it for children to be able to work. For families to be able to work. And we are here to be the ones to provide that care for children, along with the fact of the child care scholarships. Providers need to be paid efficiently and in a timely manner so that we can provide the services that our children need, so they can get the things that are best suited for their education, and so they can be productive citizens and also join our workforce one day later in their life. if we don't get enough parents and families on the scholarship program, many children just don't get the benefit of being in a place where they can get all of the things they need and the lessons that they need to learn. By using the scholarship program and having it affordable for families, it would just make a huge impact in more families using childcare from families as well as center providers, and make a big difference in the outcome of children's lives and families. I thank you for allowing me to speak on behalf of this bill.
Ms. Reyes for 2 minutes, please.
Yes, hi everyone. Thank you for letting me speak. I urge your support for this bill to help ensure a thriving childcare system in Maryland for our families. Childcare providers are in crisis, also our families, and Prince George County, my county, is not exception. I am also not an exception. Did you know the majority of the centers and family childcare are owned and run by women, and the workforce is a majority Black and brown and immigrants? I am one of them, and I'm an immigrant that serves a diverse group of families who value high quality childcare centers and a bilingual education. As an owner director of Arcoiris Bilingual Children's Center, I have seen how many families have struggled paying for childcare during the last few years. It is unlike anything I have seen before. Many families want to come to my center because we provide high quality education with well-educated teachers in a unique bilingual environment. However, they cannot due to their economic means, which do not give them access to their own. When these families want to access the childcare scholarship, they enter a system that is bureaucratic and burdensome. I'm sorry. For instance, one of my families who lack English proficiency applies for the scholarship. 1 month later, they receive a letter saying that they were missing documentation. However, the letter was dated 2 weeks prior, which means the letters arrived late. Now the family must run a burden of looking for the necessary paperwork that often find themselves running out of time. The result is that the family has to reapply all over again, and they simply give up entirely. The letter came late. This issue not only happens in this family, but I see it all over and over again happening. The extensive and unprecedented delays in providing financial resources for working families and single mothers is very serious. This issue not only impacts families, but also childcare providers. This bill will help families and offer them the ability to access high quality childcare centers like mine. Although the state has increased the income levels for childcare scholarship, I have seen firsthand extensive delays and providing resources for working families and single mothers who often lack support system. These families rely on childcare centers to re-enter the workforce.
Reyes, can you wrap up your testimony,
Yes.
please?
Therefore, providing the rapid and efficient assistance for these families is necessary not only for them, but also for the childcare centers, which are essential ingredients for ensuring a healthy Maryland economy. Thank you.
Thank you. Next, Ms. Push, please, for 2 minutes.
Yep. Thank you so much, esteemed Ways and Means Committee and Chair Atterbury. I'm Christina Push, Executive Director of the Maryland State Child Care Association. MSCCA's priorities agendas includes ensuring families have access to affordable, consistent, quality childcare options and to alleviate barriers for families and childcare providers, as childcare is essential to the economy. We believe children are our most important natural resource and must meet the needs of all Maryland's children from birth to 5 and beyond. House Bill 933 and all the child care bills in this package align with these priorities and will address numerous obstacles and inequities to fix our child care scholarship system and support more deserving children, families, and the child care businesses. HB 933 is an important piece of legislation which focuses on the child and allowing our most vulnerable youngest learners opportunities for continuous care education without interruption for 12 months, regardless of the parent's work status. Additionally, HB 933 does not hold the child accountable for the issues related to child support, as children should not suffer due to proof of child support for our most at-risk communities. The child care scholarship system should be respected as investments and not entitlements, just as scholarships for higher education are. Children's brain development is at its highest height and during the first 5 years, and the return on investment is high when we start early. Maryland must require a more equitable, welcoming, efficient, expedient, and effective system of support through child care scholarship program. MSCCA urges a favorable report. Thank you so much.
Are there any questions for any of the panel? Okay, seeing none, that concludes the testimony on House Bill 933. We are going to go out of order, and Delegate Ebersol, can you present 993? House Bill 993, thank you.
I sure can, Madam Chair.
We have a little conundrum here. A lot of the folks we need are in appropriations. This is jointly assigned and they're supposed to be here. But they're voting, but there's nothing we can do about that right now.
I'll tell them all about it. Okay. Do you want me to go ahead?
Yes,
Okay.
Go ahead, please.
Thank you, Madam Chair. I bring to you House Bill 993, which is a bill that creates a, I get the wording correct. Sorry, I was just a little bit, Child Care Capital Support Revolving Loan Fund. The idea there is that we are going to, over the next 3 years, create a fund that will extend interest-free loans for capital improvements, for capital expansion, renovations, or even new construction to childcares so that they can exist. There will be some priority given in how they are administered. Some priority with MSD for rural areas or underserved areas or places where there are no slots in places that have childcares. The idea is that they will obviously borrow the money. They will pay it back interest-free within 5 years. There are opportunities for extensions or waivers if indeed they find themselves in a place of hardship of trying to repay them. So it's a revolving fund. It is for $15 million in fiscal year 2023, 10 in fiscal year 2024, and 5 in fiscal year 2025. All those big numbers is why you might have expected some folks from appropriations to be here to hear this. And with that, I'll conclude my testimony. And I'm not sure if we have people here to support this or not. I guess I'm betting we do.
Yeah, yep, you do. So
Okay.
first, again, Ms. Reyes, please, for 2 minutes.
Hi, everyone. This is a very important package, so we are very excited to be here. So I just would like to share, I wrote something and it seems like the 2 minutes go way too fast, but I will just share what we have in experience. As a childcare provider, I will just share my own personal experience. The pandemic has brought a very heavy burden to us as small business owners like me, immigrants, many times Black and brown women, that we have provided and believe strongly in what early childhood education is all about. We have been serving our Maryland community with strong struggles, but we're still here. One example that I want to share with you is that due to the pandemic, because this has major effects to many other businesses, I had to relocate my business last year in the middle of the pandemic. I had to reach out to get a loan to be able to continue this strongly center that I think is essential for our families, a bilingual center that is going to help many families that are immigrants like me. I think that this bill will definitely support many centers like mine and family childcare providers who are struggling. For instance, I'm still not at 50% capacity even to be able to provide salaries and pay rent. So right now I believe in a loan and with the grant that we had received. So it's essential that you provide this assistance for all of us to remain in business, to remain providing the high quality settings that we strongly believe in, and to also to provide a different and mixed delivery centers like mine, like providing bilingual education and appreciation of diversity. We don't want to end. We wanted to continue being the backbone of the economy for our families in the state of Maryland. Thank you.
Laura Wheeldryer, please, for 2 minutes.
Good afternoon, Madam Chair and honorable committee members. Thank you so much for the opportunity to testify. I'm Laura Wheeldryer, Executive Director of Maryland Family Network. National experts agree that facilities are both a barrier to childcare and are highly linked with the quality of the child care program. Here in Maryland, MFN is the largest early Head Start grantee in the state, and we run the Child Care Resource Center network. So we are in daily contact with child care providers, and we can affirm that those national experts align with what we see locally. Facilities are a huge obstacle to operating childcare. Licensure, as you probably know, has very exacting requirements for the health and safety of our young children. And those requirements make finding a building extremely challenging, especially for an industry that has operated on the thinnest of margins and then was devastated by the pandemic, as you just heard Carolina say. Accessible, high-quality childcare is a public good that supports the development of young children, working parents, strong families, and a robust economy. This is a much-needed step in acknowledging the challenges of locating, purchasing or leasing, and renovating a facility for childcare. In addition, tying the access to the loan to participation in childcare scholarship is a beautifully aligned statement of values that prioritizes serving our most vulnerable children or our most under-resourced communities. We know that not every family in Maryland has equal access to high-quality childcare. House Bill 993 is an important step in addressing that concern. We urge a favorable report. Thank you so much.
Next, Rebecca Hannock, please, for 2 minutes.
I think she's having trouble getting in. She keeps coming out, keep letting her back in again. So. Sorry, Madam Chair, we didn't hear that.
Oh, I said we'll move on then to Ms. Push for 2 minutes.
Sorry, I didn't hear you. Thank you. Yes, MSCCA appreciates the leadership and advocacy and support of Delegate Eppersol, as well as the General Assembly to champion important childcare legislation. And we fully support HB 993, which prioritizes childcare for no interest loans for recovery efforts that aligns with understanding that childcare is essential and an economic driver. MSDE reported as they have lost 855 licensed childcare programs that have closed since March of 2020, a decline of over 10%. We went from 7,933 businesses to 7,078 businesses, and more continue to close fully or are unable to open classrooms due to critical staffing shortages or decreased enrollment or pandemic-related issues, as well as keeping up with record inflation and increased expenses. The only way the majority of childcare businesses have survived so far is due to the PPP loans, emergency relief loans, federal grants specifically designed for childcare industry as is the essential to the economy. Wide-scale closures of private childcare options create significant shortages beyond the shortages that already exist today in childcare deserts across our country and in Maryland. Private providers deliver wraparound care services to school-age children as well, so all children will be impacted by these closures. According to the Center for American Progress analysis, a lack of childcare negatively impacted communities of color before the pandemic, as parents of color were more likely than their non-Hispanic white counterparts to experience childcare-related disruptions. So COVID-19 has negatively impacted most of our small businesses, but especially childcare, as they have already operated on razor-thin margins, and they're highly regulated, tuition-dependent businesses, and are limited in solutions. Without the support, they do not want to pass these costs on to parents. So HB 993 is acting to offer opportunity for expanding access with an equity lens to require as a component of the capital funding participation, and MSCC requests a favorable report. Thank you.
Next, Rebecca Hannock, please, for 2 minutes.
I'm sorry, did you call Rebecca Hancock?
Yes, sorry,
Okay.
I said Hannock. Hancock,
No,
sorry.
that's fine. I am having so much trouble with my computer today.
That's okay.
Good afternoon. My name is Rebecca Hancock, and I'm the Vice President of Public Policy for the Maryland State Family Child Care Association. We represent 4,440 providers and 145 providers of large family child care homes. And I would like to thank Delegate Atterbury and the community for the opportunity to talk about and speak in support of HB 993. Maryland is experiencing a child care crisis, and this dramatically impacts working families and their attempts to locate quality child care for their children. There are not enough child care slots, especially for infants and toddlers. This bill would enable providers to access funding interest-free and allow 5 years to pay the loan back in order to expand their existing programs, thereby adding much-needed slots. Family child care providers potentially could expand to 4 infant homes, adding 2 more infant slots, family and large family child care homes for up to 12 children, which would include an additional 4 slots in their programs. MFCCA respectfully asks for a favorable vote on HB 993 and the Child Care Support Revolving Loan Fund. This legislation will expand the number of child care slots and hopefully effectively help to combat the decline in child care, consequently supporting the workforce in Maryland and helping children and families and communities. Thank you very much.
Thank you. Do members have any questions for anyone on this panel? Okay, see.
I think you missed Christina Push for this one.
No, I called her before while Ms. Hancock was coming in. Are there any questions? Okay, seeing none, that concludes the testimony on House Bill 993. Thank you very much, everyone. So we are still in this conundrum with the sponsors of the bills being in appropriations in a voting session. So I think what we're going to do is Sarah and Haley go ahead and call 995 and have anyone that is here to testify on the bill go ahead and testify. And then if the members come in, they can speak if they so choose. So calling House Bill 995, Delegate Solomon, Early Childhood Development Child Care Scholarship Program. And I'm certain if he was here, he would be asking for a favorable report. So I'll ask Fatima Whitmore, if she is in right now, to please go ahead for 2 minutes. Okay, she might not be in. Okay, Amani Angela Rose, please.
I'm here. I could not hear you. What did you say?
Go ahead for 2 minutes, ma'am.
Thank you. We're on 995.
Yes.
Thank you. I'm sorry. I couldn't hear the beginning of you. Dear Chairwoman, thank you for having me. On behalf of 20,000 working families and people in our region, I'm here to represent SEIU Local 500. As the Union for Family Child Care Providers across the state, we would like to thank Delegate Solomon for his steadfast leadership in helping us get this done. This Maryland State Department of Education HB 995 will require the state to pay child care providers within 10 days of receipt of service. This will address the unstable income providers are experiencing right now. Delayed payments or no payments at all have caused our members to face hardships. The inconsistent payments from the state have forced many family child care providers to leave our industry altogether. Their departure from providing child care has resulted in fewer families and fewer centers having quality programs because of the high turnover between staff and children. We ask that you support House Bill 995 to help our working families and members in our family child care providers that serve these families in our homes. Low-income families have been disproportionately affected by COVID-19. The COVID-19 pandemic has not caused this problem. However, it has exacerbated it. This is good state policy that needs to happen. Now is the time to make sure our low-income members do not continue to be left behind. Awarding a subsidy that eliminates a copay would allow families to continue childcare during many transitions that families face. Ensuring individuals with this support could definitely not interrupt childcare for those many children who need it. Thank you.
Thank you. Next, Ms. Amani Angela Rose, please, for 2 minutes.
Good afternoon again, and I'm testifying in favor of House Bill 995. Again, this is another step in correcting and enhancing our child care scholarship program that will benefit our families, children, and providers equally. I would like to share with you how presumptive eligibility for families would work out. I presently have been working with a family since December of 2021, and we've worked together to apply for the child care scholarship December, January, and February. And just 2 days ago, the parent was still denied for a third time, stating that their paperwork had not been received, even though the parent emailed the paperwork in through the child care Central's email and received an immediate email saying we received your documents. So when they got a letter of denial, we really just did not understand where that came from and how that could be. Furthermore, providers always are willing to help families with working on their application, even though MSDE has requested that we not assist families. But providers want to support our families, and our families need childcare. It only makes sense that we work together. And when we're trying to deal with these scholarship issues, when we call into Child Care Central, we may, after waiting at least 30 minutes at a minimum for a call, you get passed from one person to another, and never really getting your issues resolved. So we do need better systems in place with our Child Care Central program so that the families can benefit the best, and the presumptive eligibility will assure that children will get services and that providers will get paid. And to that point, the assurance of timely payment to providers will benefit our youngest members in society. With lags in payment, we, like any other business, you'll end up having to close, and we can't afford to do that. And as we can see, this pandemic has taught us that childcare is a cornerstone and the backbone of America. We need things like this in our state legislators to support us so that we can support our families who are at the most need. Again, I thank you for listening to my testimony, and I hope for a favorable vote on this.
Thank you. And committee, now Delegate Solomon has finished in appropriations and is here, so I will turn it over to him to introduce the bill and then resume with the witnesses. So Delegate Solomon.
Thank you, Madam Chair, and thank you for your flexibility. Sorry for the scheduling overlap and snafu. I first off just want to start by thanking you, the Ways and Means Committee, and the Speaker. So the bills that you're hearing today, I know you heard Delegate Ebersol's revolving loan fund and this bill and the bill that I will be presenting for Delegate Queen today as well, are part of the broader child care priority package that we've been working on. And it's really been a priority for Chair Atterbury, for the Speaker, and it's been a great working relationship. I'm really proud that this is a priority of our caucus. I think it's going to help so many families. So this bill in particular deals with a lot of the policy issues that we have with our child care scholarship program. So as you've probably heard already, we've got some of the most expensive child care in the country. In almost every corner of the state, families spend about 25% of their income in a given month on child care. And we have invested really a tremendous amount of money over the last 3 or 4 years, really because of the Speaker's leadership. Even before she was Speaker, when she chaired the Education and Economic Development Committee and Appropriations, she made this one of her priorities, and Maryland really moved from, frankly, one of the worst states in the country in terms of helping families afford childcare to one of the best. We've gone from the level used to be a family of 4 making about $35,000 a year would qualify for some sort of a scholarship. We've now almost tripled that to, with this year's budget, a family making almost $90,000 a year would qualify for some sort of a scholarship, which is fantastic because we know really our economy doesn't work without childcare. If you don't have a safe place, as any parent here will attest to, if you don't have a safe place for your child during the day, you can't work. And so it's really critical that we have not only a robust childcare sector, but we've got really high quality childcare, and that families can afford and be able to take advantage of that. And so while we've done a lot of work to address the affordability gaps, we have a lot to do on just the policy and actual mechanics of being able to qualify for the scholarship. And that's really what this bill is about. You heard a little bit about presumptive eligibility. Presumptive eligibility is moving us to a place where we are doing work with some of the best states in the country. And you're going to hear from a national expert with CLASP that Maryland would move into a place where we take the burden off of families to figure out how to actually get the scholarship, to allow families on day one to be able to get enroll their child in childcare, and be able to go to work, be able to take advantage of the employment opportunities that they have, instead of waiting sometimes as much as 90 days to have their paperwork processed. That we alleviate the burden on the providers so that they are able to work with families, they're able to serve their children in the ways that they should, instead of having to worry about paperwork nightmares. So the presumptive eligibility piece is I think going to be a groundbreaker for so many families who struggle to be able to get slots. The other 2 big pieces of this bill are we are going to broaden the sort of dual eligibility or express lane provisions that we have in statute. So right now, if you qualify for Social Security income or temporary cash assistance, your application's essentially streamlined. You show that you get that, you prove that you're employed, and then you automatically can qualify for a child care scholarship. Well, we have 6 or 7 other programs across the state with similar income eligibilities, but we make families have to fill out multiple applications. And when you look at the child care application, it's confusing. Even as somebody who's worked in this field for a long time, I still get cross-eyed looking at it. And so what we do is for those families who are most in need, who are getting food stamps, who are getting WIC assistance, who qualify for housing vouchers, who qualify for our additional higher ed scholarship programs, we say, if you've done that application already and proven to the state that your income meets a certain threshold, we're not going to make you jump through all these hoops again. We're not going to put all these burdens on providers to figure out that paperwork. You're going to get in the door as quickly as you can. And then lastly, we know, as you've heard today, providers need assurances that they're actually going to get paid for the work that they're doing. And we have too many horror stories of providers who say, I don't feel comfortable taking another scholarship student because I haven't gotten my payment and I'm operating on the margins. We know providers don't do this for the money. They do this because they care about children, but they are small businesses. They have to meet payroll. And so the provision in this bill ensures that MSDE, working with the comptroller, will get payments to providers in a reasonable period of time when the providers provide the invoice and the information back to them. And so I know MSDE submitted some favorable with amendments. We're working with them to clarify some of the language in the bill to just make sure that we're within reason and we can actually do what we're talking about. But I think this bill, for a relatively small amount of money, will have a huge impact of really making our system fair and accessible, and hopefully for thousands of Marylanders, make it possible for them to get access to childcare. So with that, thank you again for your flexibility on the timing, and would ask for a favorable report.
Delegate Solomon. And next to Hannah Matthews, please, for 2 minutes.
Thank you, Chair Atterbury. Thank you, Delegate Solomon, members of the committee, for the opportunity to testify in favor of HB 995. I'm Hannah Matthews. I'm the Deputy Executive Director for Policy at the Center for Law and Social Policy. We are a national anti-poverty nonprofit organization, and I have spent my career advancing federal and state policies to improve childcare assistance for families with low incomes. HB 995 will strengthen the Child Care Scholarship Program by making it more accessible for eligible families, streamlining enrollment for many families, and enhancing stability for providers. With this legislation, Maryland is adopting best practices in child care subsidy policies and will lead the way for other states. The scholarship program is a crucial support for families. It helps parents work and helps children learn and grow. However, administrative policies can make it difficult for families to get and keep scholarships. We know from research that burdensome processes and policies hurt those greatest in need and exacerbate inequities. What may appear, for example, to be simple tasks such as disclosing income and employment can in fact be complex for individuals whose work hours or earnings fluctuate. And that's a significant share of workers earning low wages and disproportionately workers of color. Presumptive eligibility will ensure timely access to care when it's needed, an important step to get families back to work following the pandemic. This policy allows time to complete and process applications without jeopardizing a new job. The bill also eliminates the child support enforcement requirement, which serves as a barrier to access, disproportionately impacting single parents and parents of color. Just 13 states, including Maryland, condition childcare eligibility on child support cooperation, with several states moving away from this policy in recent years. Finally, the bill ensures timely payments for providers. Childcare programs operate on very thin margins. Predictability in payments can offer some stability and relief to providers who rely on public subsidies. This legislation is really a critical step forward to improve the scholarship program for children, for families, and for providers. Thank you so much for the opportunity to speak today.
Thank you. Next, Ms. Reyes, please, for 2 minutes.
Good afternoon again. My name is Carolina Reyes, and I am pleased to be able to repeat once again what I think is necessary for you to pass this bill. Once again, over and over, we see the common problems experienced by families and the providers who serve them include the lack of or delayed communication from the delayed payments to providers. MSDE is asking the paperwork to be sent and leading to duplication efforts that many times parents, particularly me, who I am representing my immigrant and Latino community who many times may lack English proficiency, they give up completely and they really need to enter the workforce. I honestly, I see also that we always constantly have artists requesting paperwork to be sent once again. A deep and profound misunderstanding by families how to correctly apply. So this bill will be allow them to enter the workforce efficiently and rapidly, and also to be able to provide them assistance on how them to be able to enter the workforce again. Since the state of Maryland has cut unemployment, this benefit will benefit all our families and more proceeding than ever to solve the issue that, like I say, many of you, the delayed on, getting the scholarship. That way they will be able to get in right to centers with quality education. These families relied on childcare centers to re-enter the workforce, and that is why we need once again this bill. So I will end by saying that I hope that most of all the suggestions and these, testimonies that many of my colleagues are providing today take to heart, and you can be able to provide the necessity and the money and the financial support for our families. Thank you.
Next, Laura Weedle-Dryer, please, for 2 minutes.
Thank you so much for the opportunity to testify, Madam Chair, Delegate Solomon, committee members. Again, I'm Laura Weedle-Dryer, the Executive Director of Maryland Family Network, and I'm here today in strong support of House Bill 995, which would make vast and much needed improvements to the Child Care Scholarship Program. Scholarship is our largest public investment in childcare and absolutely must work efficiently and effectively for all parties involved. Otherwise, it does not serve our young children, our hardworking families, or our public interest in making high quality care available and accessible around the state. The values and the aims of scholarship are laudable, but to be honest, we are not fulfilling our promise to families who need to work, their children who need and deserve high quality licensed childcare, or to our hardworking childcare providers. And I know this because Maryland Family Network recently hosted 2 statewide town halls attended by over 250 childcare providers, specifically on the issue of scholarship. I spoke to a provider from the Eastern Shore who runs a small center, and she told me a very typical story that she enrolled a child in July of 2021 after reviewing the documentation submitted by the parent and feeling absolutely certain they would be approved. She has been serving this 2-year-old while the parent waited and waited and waited. The parent was finally approved in February of 2022. That's 9 months after first applying, and back pay was only authorized to November, which means the family is holding a bill for $2,000 of back childcare. And the provider is reconciled that she is never going to see that money because the family simply can't afford it. The proposed provisions of House Bill 995 are key in transforming scholarship into the social support it was designed to be. We urge a favorable report. Thank you.
Thank you. Next, Rebecca Hancock, please, for 2 minutes.
Good afternoon again. My name is Rebecca Hancock, and I am representing the Maryland State Family Child Care Association. Ideally, the scholarship program is in place to help working families have access to and help pay for quality child care for their children. Currently, it is less than successful. Excuse me, the application process is arduous and confusing at best. Parents have had services denied for a single piece of missing information. The bilingual community, both providers and parents alike, struggle due to the huge language barrier, making it difficult to have their questions answered. Providers are also put in a position of not knowing when or if they will receive payment for their services. We believe that HB 995 will enable more parents to take advantage of the scholarship program by offering presumptive eligibility. Meaning, a parent who is already receiving government assistance can automatically enroll in the program while the department verifies their ability to remain in the program. In addition, removing the child care support requirements will enable more parents to participate in the program, especially parents involved in domestic violence situations. I would like to share a personal story that I did have a mother who had a domestic violence restraining order. When the restraining order expired, the Child Care Central would not renew her voucher. We had letters from her attorney. We had letters from us saying just because the restraining order expired did not mean the father was any less dangerous. And after 3 more attempts to try and get the voucher renewed, they denied it. So the mom said, well, I'll just see what I can find. And she left. I have no idea where the child is. I don't know if she's in quality childcare. I haven't been able to get a hold of the mother, which is really, really scary. So, so consequently, the child was pulled out of my daycare. Providers have also shared with us the horror stories of not being paid. We've had providers, especially during the pandemic, watch children for over 2 to 3 months at a time and still have not received payment for their services. So, excuse me, requiring the department to streamline the application process would also benefit working families in Maryland. Many times the process takes too long.
Can you wrap up your testimony, please?
Okay, I'm sorry. We excuse me, we appreciate the positive changes outlined in HB 995 and look for a favorable report. Thank you.
Next, Christina Push, please, for 2 minutes.
Thank you, Delegate Atterbury. Christina Push, Executive Director of the Maryland State Child Care Association, and I echo my colleagues and partners on this at this hearing in full support of HB 995. HB 995 is a culmination of hard work to understand the child care scholarship system breakdown and determine ways best to effectively and equitably serve and hopefully expand services for children, families through willing partners of the private child care businesses providing a public good. And as you've heard, there has been way too many times that child care businesses are subsidizing the subsidy. I've co-hosted the same town halls with my partner, Laura Wheeldryer and MFN, as I have with the Maryland State Family Child Care Association. We've done our own surveys. We found this to be a huge problem, and we thank Delegate Solomon and for championing this really important legislation that will make an impact. Child care is an economic and equity imperative. It's essential to the economy and critical to our most vulnerable children and families. Due to the record investments we now have at the federal and now on the state level, earmarked for necessary change in child care scholarship program, now is the time to make these changes in order to have an equitable, efficient resource to support families. And we urge a favorable report. Thank you so much.
Are there any questions for Delegate Solomon or any of the witnesses? Okay, seeing none, that concludes the testimony on House Bill 995. Committee, we are going to switch up our agenda again, and thank you, Delegate Solomon, for accommodating Delegate Valentino Smith. She has some scheduling challenges, so we're going to call House Bill 1004, Delegate Valentino Smith. Is she in here?
And thank you for all your flexibility in adjusting schedules. So I'm here today to present House Bill 1004, the purpose of which is to ensure that there's a nurse in every school. You know, I, as myself as a nurse, know nurses are uniquely trained to do assessments, both physical and psychosocial and psychological. Beyond physicians, no other healthcare providers are trained to perform such skilled assessments. School nurses, as you know, strengthen and facilitate the educational process by improving and protecting the health status of children and the identification and the removal of health-related barriers. The major focus for school health services is the prevention of illness and disability and the early detection and correction of health problems. You all are the ones that hear all the testimony about the need to have healthy children, and a nurse is needed in every school because in the last few years, the children that are in our schools have so much more complex physical and mental needs. We know right now from the legislation that you passed from the good Delegate Washington that there's a mental health crisis in youth and our children, and that you validated the fact that you're going to need healthcare providers in the school when these children come back to school after their leaves of absence. They manage the care of chronic disease of many of our students. A growing number of children suffer from chronic disease, diabetes, high blood pressure, obesity, and asthma. 25% of children have at least one of those chronic diseases. As a result of mainstreaming, the school health services and the demands for them have become much more complex. We have children with severe cerebral palsy, severe epilepsy, and multiple physical disabilities. These children deserve to be able to stay in school as much as any other child, and they must have a nurse on site to maximize their potential. They support parents in obtaining the basic health services, and by statute, we've required hearing and vision testing. We've mandated physical examinations before entering school and someone to look at the results. We've mandated COVID testing and various vaccines, and somebody must be in the school to review the outcomes of all of these mandates and to make sure there's communication with the parents and that there's follow-up for the vision, hearing, and vaccinations. When there's not a nurse on site, as you know right now, we rely on certified nursing assistants and unlicensed healthcare providers. They're important, but they're not a substitute for nurses. Their training is limited, and only nurses can manage chronic illness and regularly supervise the management of complex medications. The blueprint, as you all know, recognized the need to have healthy students and families, and you've tripled the investment in school-based health centers. You've added an extra $6.5 million. But that is serving the needs of a population of predominantly high concentrations of poverty. And although that's important, it does not ensure that there's a nurse for every child in every seat. I know this bill is going to seek and requires further investment. I want to talk about the opposition's concerns. They're concerned because some nurses are employed by local school boards and some are employed by local departments. I'd like to work with the subcommittee on that. I think the good news is read the opposition, because the opposition is very strong on why you need a nurse in every school. It just talks about being opposed because of the funding and where the funding will come from for the local school boards. Our groundbreaking investments in the blueprint are going to come to about $3.5 billion. This year, the capital budget has $400 million in it to build schools. We can start to have the best teachers and we can start to have the best physical surroundings for our students, but it will not work as it's intended because without ensuring that the students are healthy, the investments that we're making are not going to work and not going to be maximized. Providing access to a nurse in schools with high pockets of poverty is a start, but I really firmly believe it's time now that we recognize that every student needs to have access to a nurse during their school day. Being healthy is the most important element in learning. We need the nurses to make sure the students are safe, they're healthy, and they can learn. A healthy child is really the only way we can maximize what we did in the blueprint and what we're doing with our capital investment. So with that, I look forward to working with the subcommittee, working with your committee, and moving us even further than the blueprint did and making sure there's a nurse. I think we all remember going to the nurse's office. We all remember what they offer during the school day. Thank you, Madam Chair. Thank you, members of the committee.
Thank you. The remaining witnesses will have 2 minutes each. Suhani Shatalia.
Good afternoon, Chair Atterbury, Delegate Valentino-Smith, and members of the Ways and Means Committee. For the record, my name is Suhani Chitalia, and I am here on behalf of the Maryland Dental Action Coalition. The Maryland Dental Action Coalition's objective is to develop and maintain statewide partnerships to improve the health of all Marylanders through increased oral health promotion, disease prevention, education, advocacy, and access in oral health care. The Maryland Dental Action Coalition supports good policies that would improve overall health, particularly for children. Cavities are one of the most common diseases, and I'm sure everyone here has in some way heard or supported a child who has been treated for cavities. I was one of them. It's the most common disease afflicting a student population, with approximately 20% of children between 5 and 11 years old having at least one untreated cavity. The most practical way to combat cavities is through dental sealants. The Maryland Department of Health runs a Mighty Tooth program, which is the state's school-linked dental sealant program. School-based dental sealant programs are incredibly important to enhance screening, education, and dental sealant application in a school setting. Dental teams are set up in gyms, auditoriums, unused classrooms, and even nurses' offices. For this to happen, school nurses are essential. They support this program to run efficiently, and nurses champion this program by coordinating and implementing the sealant program. School nurses are key to ensuring students are receiving basic dental care and taking preventative measures to better their oral and overall health. With this, we urge a favorable report on House Bill 1004, and we thank you for your consideration.
Thank you. Next, Dr. Charlotte Wood, please, for 2 minutes. Charlotte Wood, please, for 2 minutes.
Sorry, I was trying to unmute myself here.
Okay.
Good afternoon, Madam Chair. It is nice to be here this afternoon, and good afternoon to our distinguished committee members. I am Dr. Charlotte Wood. I'm a professor at Coppin State University. I'm a nurse of 40 years and the immediate past president of the Maryland Nurses Association, representing over 4,000 nurses. House Bill 1004 supports having a full-time nurse in every public school. Many of our schools do not have a school nurse, and of the schools that have a nurse, many of those nurses are split between multiple schools. During COVID, the school nurse was and continues to be an essential resource for contact tracing and maintaining vaccine records. This helps to ensure healthy children. Healthy children learn better. Educated children grow to raise healthier families and create a stronger, more productive nation for generations to come. Health is inexplicably tied to student readiness to learn, and education is a social determinant of health that predicts a person's future success and the health of his or her own children. Our children combine to lay the foundation for powerful forces that can either benefit or hinder a nation of communities. And school nurses stand at the intersection of both health and education, weaving supports needed to reduce barriers to learning and promoting healthy children, families, and communities. Therefore, House Bill 1004 is a great opportunity for us to initiate a foundation for a stronger nation. We thank our sponsors, Delegate Valentino Smith, and we humbly request a favorable report for House Bill 1004. Thank you so much for this opportunity.
Thank you. Next, Nancy Austin, please, for 2 minutes.
Good afternoon. My name is Nancy Austin, and I am a school community health nurse employed by the Montgomery County Department of Health and Human Services. I currently provide nursing support to 2 schools that are a 20-minute drive apart. We have seen a huge increase in mental health concerns in school. The first place those students come to is the health room. Stomach aches, headaches, avoidance, and frequent visits can be symptoms of concern. It's okay and a safe place to come to the health room. It is then the assessment of the nurse that is most important. Diabetes is a preventable and complex disease. With the help of technology such as continuous glucose monitors and insulin pumps, a student can also avoid some of the long-term complications of heart disease and kidney failure. Having a nurse in the school is the best and safest way to use the technology and monitor these students. I work in zip code 20876, home to the most diverse population in Montgomery County. I live and work in a county with 1.1 million residents, 208 schools, and 159,000 students. Working in a single school would allow me to establish relationships, to better know the school community, and to develop an understanding of local resources. Recently, there were 2 911 calls at the same time at one of my assigned schools. The emergencies occurred 8 miles from where I was sitting. I could not be on site to assist because of the distance and because I was the only on-site trained staff for a very young student with diabetes, so I couldn't leave. Students and parents deserve better. We see and care for medically fragile children every day. The health accommodations afforded by a 504 plan or an individual education plan all start with a healthcare plan. No matter how many professionals are involved in accessing education for this student, it all begins with a registered nurse, the only one who can write a healthcare plan. Thank you, and I support House Bill 1004 for a nurse in every school.
Thank you. Next, Christy Schmar, please, for 2 minutes. Perhaps she is not here. Christy Schmar. Okay, Michelle Simmons, please, for 2 minutes.
Good afternoon, Madam Chairperson. Good afternoon, delegates and chair committees. Good afternoon, Delegate Valentino Smith. I want to thank you all for giving me the opportunity to speak on House Bill 1004, a nurse in every school. My name is Michelle Simmons. I'm currently a Coppin State University nursing student, and I'm also the single parent of a 11-year-old son who is asthmatic with multiple food allergies. So it is important for me to have a nurse in every school, as I have been the recipient of such care of my son. The nurse was able to administer during his anaphylactic reaction. She was able to administer his EpiPen and also stabilize him until the ambulance was able to take him to the emergency room. I've also been in my clinical rotation with nurses in school and community health. And during my rotation, I was paired with a nurse that was supervising multiple schools. So during the course of the day, we had to drive to a few locations in order to get the students the medication that they deserved. And this was taxing because by the time we drove to one location and administered that medication, we had to go back in time to go back to get the other student their medication. And so I believe in the importance of a nurse in every school, as this would, the attention and the time needed to focus on these students individually would be allotted because that nurse would be in that facility. We have seen an increase in chronic diseases in children in the last few years. And I believe as one of the caretakers for these students, as far as having nurses in school, I do believe that is important. I want to thank you, Madam Chairperson and Delegate Valentino Smith, for having me here today and giving me the opportunity to speak on this bill. And we are looking forward for a favorable report.
Thank you. Next, Scott Tiffin, please, for 2 minutes.
Thank you, Madam Chair and members of the committee. My name is Scott Tiffin. I'm here on behalf of the Maryland Community Health System, as well as the Maryland School Psychology Association. In strong support of this bill. In particular, I want to talk about the important role nurses play in our behavioral health services. Nurses are often the frontline screener or identifier of students who may need behavioral health needs. And oftentimes, because our behavioral health providers aren't in the school every day, the nurse is really involved in coordinating appointments, communicating with family, ensuring there's follow-up when the kid needs services at home or in the community. So we could not provide behavioral health services that, were so important to the blueprint without school nurses. And if we don't have one in every school, it kind of cuts off that opportunity in some ways. As was already discussed, the blueprint did require a school nurse in every school or to be covering every school for a concentration of poverty schools. I think for one, we think that probably there's much broader need than just in our concentration of poverty schools. And then in addition, it does not actually appear that all of the concentrations of poverty schools are actually having a full-time nurse staffing each school. A lot of times those nurses are still being split amongst multiple schools. And the last thing I wanted to flag is in the written testimony is a chart where we show how many nurses per student for every county. And there's huge disparities. In some of our rural counties, there's 0 nurses in all of the schools. And in almost every county, the ratio of students to nurses is very, very high, much higher than any nurse could really ever, provide services to that number of students. So we just ask for a favorable report, and I'm happy to answer any questions.
Thank you. Larry Epps, please, for 2 minutes.
Thank you, Madam Chair and members of the committee. I pray that this pandemic has come to an end, but whether it has taken a brief recess or it will continue to plague us for years to come, I think we have all learned that Maryland's school nurses were among the unsung heroes in the fight against this unimaginable disease. As a past president of the Licensed Clinical Professional Counselors of Maryland and a past director of school mental health services for Shepherd Pratt, I want to recognize the role school nurses played in containing and mitigating COVID-19 in our schools. They were the front line of primary care for every child in Maryland. They were among our dedicated inoculators, contact tracers, and testers. And while over 50,000 children had been sickened in Maryland and 22 sadly succumbed to this deadly virus, I have no doubt that this situation would have been much worse had it not been for the work of our school nurses. Through this pandemic, we have learned that school nurses are a critical part of our public health infrastructure. If this pandemic has not taught us that we need a full-time school nurse in every Maryland school, not only to address the COVID-19 variants and pandemics of the future, but also to screen youth for mental health issues, substance abuse, child abuse, domestic violence, and coordinate the care for these and countless other childhood disorders that were all affected and exacerbated by this pandemic, we have not learned the pandemic's most important lesson of how precious and precarious our and our children's health is. And most importantly, we know school nurses have saved lives. We have seen them help children who have been injured. We have seen them support youth who've been shot by other youth. And we have seen them render aid to our teachers who have suffered unexpected health events during the school day. We have known for many years that when a school nurse is present, children are absent less because their health conditions are better managed, and the trained health professionals available who can respond to emergent symptoms and administer medication to the 6% of children who depend on medication to stay in school. By stationing a school nurse full-time in every Maryland school, in the face of those who decry its expense, we make it clear that we see our children's life and health as priceless. And by investing in school nurses,
can you please wrap up your testimony?
yes, by investing in school nurses, we're ensuring the gift of good health to all of Maryland's children. Thank you.
Thank you. Next, Joy. I'm not going to try to pronounce your last name.
Twessage.
Twessage. Thank you. Ms. Joy
Hi.
Twessage, please, for 2 minutes.
Thank you, Madam Chairwoman. Thank you. Good afternoon, members of the Ways and Means Committee. My name is Joy Twessage. I'm a board chair of the Maryland Assembly on School-Based Health Centers, otherwise known as MASBIC. I'm a nurse practitioner, Baltimore City resident, and proud parent of a second grader at Medfield Heights Elementary. So I am testifying in support of House Bill 1004 for school nurses in every school. Each day in the US, millions of children and adolescents go to school with physical and mental health concerns that threaten their well-being and educational performance. So while Maryland just has a portion of these children, we at MASBIC and staff in the school-based health centers across the state are committed to making sure that they get exceptional care. And we exist so that they don't fall through the cracks of the healthcare system. School nurses and school-based health centers are peas in a pod when it comes to caring for the health of the school community. The school nurse is responsible for the day-to-day oversight and management of the school population's health, and school-based health centers, which may include primary, behavioral, and oral health care providers, provide acute care services to enrolled students. So should schools have a school nurse and a school-based health center? Absolutely. While school nurses are working to make sure that diabetes and other chronic conditions do not get in the way of a student's education, school-based health centers are diagnosing and treating illnesses as well as prescribing and dispensing medication. While school-based health centers might not be in every school, we wholeheartedly believe that every school needs and deserves a school nurse. Like I said, we're peas in a pod when it comes to ensuring that our school communities and your constituents are well. We hope you provide a favorable report. Thank you.
Thank you. Kyle Potter, please, for 2 minutes.
He's in a meeting at his school. He's a school provider, so he's actually stuck
Okay.
in a meeting right now.
Okay, thank you. Caroline Kemp, please.
Good afternoon, Madam Chair and members of the Ways and Means Committee. I am a nurse practitioner and a Doctor of Nursing Practice student. My capstone project has been a policy analysis on school-based mental health services. Based on my research, including interviewing school nurses in different states, I have found that school nurses are an essential component to combating the mental health crisis facing our youth today. Even before the COVID-19 pandemic, mental health concerns were the leading cause of disability and poor life outcomes in young people. The mental health crisis has now been compounded by the pandemic. In December, the Surgeon General, Vivek Murthy, issued an advisory to highlight the urgent need to address this crisis. On Tuesday night, President Biden called the nation's mental health crisis a priority for his administration. The psychological costs of the pandemic will continue to persist for years to come, especially with the concurrent rise in social media use, with students as young as kindergartners getting smartphones. The role of the school nurse is more crucial than ever. Nurses are trained to use critical thinking and look at the whole child, including both physical and mental needs. So often, mental health concerns have physical symptoms as well. School nurses are sometimes the first to notice mental distress through somatic manifestations, such as headaches, dizziness, nausea, or signs of self-harm. When nurses are rotating between schools or not present daily, other staff members must fill in with triaging medical or mental health issues, which can be very dangerous. Placing a nurse in every school will alleviate that burden from overworked teachers and staff. Having a full-time nurse in every school would improve the effectiveness, efficiency, and equity of mental health care for our youth. Maryland should be a leader in the United States and put a nurse in every school. Thank you.
Next, Christy Schmar, please, for 2 minutes.
Hi, good afternoon. My name is Christy Schmar, and I'm currently a school nurse in Worcester County. Bear with me, you may see some kids walk by because I'm actually at work right now. I transitioned from hospital nursing and outpatient care into this role 3 years ago, as I felt it would be positive for my home life and as my children would be attending the same school that I took the position in. I was also in the process of acquiring my doctorate to become a nurse educator, and admittedly believed that the pace would be more manageable than what I had become accustomed to at the hospital. I had an antiquated vision of what my job would consist of and shared the common misconception that I would only be giving out a lot of Band-Aids and ice packs, which I do admittedly give out quite a bit. But I was very humbled once I started the position and realized how extensive the role truly is. Not to mention that a pandemic began the year that I was hired, which was obviously enlightening and showed how much a school nurse is really needed. But without that, which is a whole other meeting entirely, I learned that school nurses must be able to provide a comprehensive list of care and services. Just jumping in, I feel like you probably have covered that. So I won't, in the interest of time and redundancy, I won't go over all that list, but I will say that we're typically the first ones that students go to for mental health needs, which are disguised as frequent benign health room visits, and the ones to detect signs of physical and sexual abuse. We are not only school nurses, but serve unofficially as counselors and substitute parents in many ways. According to the CDC, school nurses not only make a big difference for student health and academic achievement, but they can save money. Research shows that for every dollar spent on school nursing, society saves $2.20. These savings come from preventing costly emergency room visits and parents missing time at work to care for sick children. Also, it was stated that more than 40% of school-age children and adolescents have at least one chronic health condition, such as asthma, diabetes, seizure disorders, food allergies, and poor oral health. But rather than reading you lists and statistics, I would like to provide you with examples that have occurred within the school, even as recently as last month. We had a young middle school age student overdose on medications from her parents' home medicine cabinet with a friend, which resulted in the need for Narcan administration that ultimately saved her life. We had performed Heimlich removers on children that were choking, administered epi for bee stings, food allergies. We're prepared to respond to literally anything and everything that may come our way during our vigilant watch on a typical school day. To expand on that further, we also serve as unofficial.
I'm going to have to ask you to wrap up your testimony, please.
Okay. In conclusion, I'd just like to leave you with one of my new favorite quotes that I proudly display in my health room, which is students must be healthy to be educated and educated to be healthy. School nurses help to ensure that both of these occur and quite simply illuminate how important it is that each school system ensure that there's a full-time nurse in every school building. Thank you for your time.
Thank you. There are, committee, before I go to the two unfavorables, are there any questions for those that testified in favor of the legislation? Okay, seeing no questions. Next, John Willems, please, for 2 minutes.
Madam Chair, members of the committee, John Willems, representing the Maryland Association of Boards of Education. Certainly can't argue with anything that you've heard from the sponsor or supporters regarding the value of school nurses and the role that's identified in the blueprint for school nurses and health professionals in community schools receiving the concentration of poverty funding and intended to provide and facilitate the wraparound services so critically important to those schools. That said, while I promise to say only positive things about the blueprint from this point forward, the blueprint raises a number of issues around staffing, and you'll hear bills, you're hearing one today and also next week, around school health professionals, around para-educators, educational support personnel, which includes custodians and food service staff as well. Our staffing needs are broad, and we care deeply and value greatly the services of all those professionals. A standalone mandate, again, to require that by July 1, 2022, we are able to place a registered nurse in every school is aspirational, clearly, and would certainly benefit the caliber of health services for students, but is not in the budget forecast or development at this point as it relates to either the state or county related to the shared costs of the employee personnel expansions under the blueprint, for instance. And so there's just a lot more to this in terms of mandating a nurse in every school. I have to say, as the son of a registered nurse who ended up having a career as a home health nurse and special educator, I get it. And as a parent, having students with acute or chronic health needs and relying heavily on the school nursing staff in their public schools, greatly value that service. But as a standalone mandate, this would be very, very expensive and I think unrealistic to accomplish as proposed in the bill. And for that reason, we request an unfavorable. Thank you.
Thank you. Next, Brianna January, please, for 2 minutes.
Good afternoon, committee. Brianna January with the Maryland Association of Counties in respectful opposition to HB 1004. Counties generally agree with the merit of the bill, and we thank the bill sponsor for starting this conversation. However, we do have several concerns, and we do think that this is best suited as a conversation and not a legislative fix at this time. We share many of the same concerns that Mabe just presented, and of top of mind are the specific local needs that each county factors into the hiring and staffing of school nurses. You heard the bill sponsor note that counties currently employ school nurses through a variety of arrangements that best suit their unique needs, and some do so through their local school boards, while others do so through local departments of health, for example. This bill would take away that flexible, effective policy, and MACO would be happy to work with the committee on addressing that. Additionally, however, while requiring a registered school nurse full-time in public schools with large student populations may make sense for some jurisdictions, it's not necessarily the best practice for those with smaller student populations. And in fact, some jurisdictions are better suited for mobile school nurses that are jointly employed by neighboring low enrollment schools, for example. And of course, just to reiterate what Mr. Willems noted, the mandate of a full-time licensed school nurse in each public school would be a great financial strain for counties, especially as you've heard, as we ramp up our funding to our local schools as required under the blueprint. And counties do echo those same concerns that the boards have around staffing and funding needs that were not addressed by the blueprint and adding additional mandates on top of what we're already ramping up. So committee, with that, the approach suggested by HB 1004 simply does not align with the operational or fiscal realities of our local school systems at this time. And so for those reasons, MACO opposes the bill and does urge an unfavorable report. Thank you.
Are there any questions for the last two witnesses? Yes, Delegate Lasanti.
Thank you, Madam Chair. And I was just curious if for the folks that are opposing this bill, if you don't think that we should have a school nurse in every school, is there any other recommendations that you might have of how we approach this problem?
Thanks for that question, Delegate. I'll take a stab at this first, Mr. Willems. If you'd like to chime in, feel free to. Our opposition is surely not with the idea of having a registered school nurse in every school. That obviously we want to make sure that our facilities are the safest that they can be for our students, and that our students are healthy and supported in all of their needs. With that, as Mr. Willems expressed pretty nicely here, Funding priorities and staffing priorities were really set under the blueprint, and counties in particular are taking quite a bit of a financial hit as we ramp up with blueprint implementation. And so we would have hoped that if this was going to be a priority of the legislature, that it would have been included in that blueprint and in the formulas that we established and agreed upon as shared funding for those priorities. So it's just not feasible, especially for our smaller counties that are really going to struggle to implement blueprint as it stands, to then add an additional mandated position in every single school, especially a position that would require a license and usually higher standards and pay scales.
I understand where you're coming from about the mandate, and I understand where you're coming from about expenses and try to make one size fits all. But I also understand the need to prioritize the health of children. So I guess I would encourage MACo to really work with partners. There's got to be another way to deal with this, maybe through nursing schools, maybe through community college. I don't know. I mean, but I think that you got some smart people around there that might be able to come up with some better solutions that are cost effective. So,
Delegate,
Any other questions? Okay, seeing none, that concludes the testimony on House Bill 1004. Thank you. Thank you. Our final bill of the day. Thank you for moving around again, Delegate Solomon. Calling House Bill 1100, Delegate Solomon. And I should say we have some folks from Appropriations here, Delegate Novotny, and I think Delegate Smith is supposed to be here. But whenever you're ready, Delegate Solomon.
Thank you, Madam Chair, and I'm pulling double duty, and I'm here to present the bill in place of Delegate Queen, who I know couldn't be with us today. But again, this is one of the bills that's part of the package, and we've worked collectively on this with your committee and Delegate Ebersol. So I'm really glad to be here to present this, and I know I'm standing between you and the end of the day on a long Friday and a long week. So we will be brief because I think we've made our points on how important childcare is to everybody. So this bill, just very quickly, is meant to specifically address some of the workforce and staffing issues that the community is facing. I think we've all heard anecdotal reports of salary increases and sort of this war on talent, and we see literally Starbucks offering $20 an hour. There was a report last week from NPR that there are Walmarts that are offering a starting salary of $24 an hour, with pretty substantial benefits. I wish we could pay a lot of our childcare providers that, and we are working really hard to increase provider reimbursements to make that a reality, but we're not quite there yet. And the unfortunate reality is that a lot of our providers, again, don't do this for the money. They are not compensated appropriately for the absolutely, critical job that they do. And if anybody has ever had to take care of a 2-year-old, as I do on a regular basis, we know it is a job that probably deserves a lot more pay than it gets. And so this bill is meant to try to alleviate some of those issues and really make a statement to our childcare providers that they matter. So it is a retention bonus fund for currently employed childcare workers, and then a new hire bonus for those who are new hires, and then a support fund for childcare providers to help cover some of the costs of employment and to be able to compete with some of the other salary increases that we're seeing in other fields. And it does that in 3 ways. So if you're an existing childcare provider, and you are in the credential program, so we also want to try to incentivize quality and for folks who are staying in the system. So if you're in the credential system that MSDE has, even if you are at level 1, you get a $1,000 bonus as long as you stay employed for the next year. If you are a current employee who wants to move into the credential system, you get a $1,000 bonus. And so we've earmarked about $10 million out of the $16 million in this bill to make that happen. The second piece is if you are a new hire, you get a $500 bonus if you agree to work for at least six months. You get the second $500 if you are a new hire who agrees after that 6-month period to enter into the credential system. Again, incentivizing quality. The hope is if you're credentialed, you'll stick around even longer. And then that last piece, we've earmarked about $2 million to help childcare providers to forego some of the costs of hiring new employees. That's things like advertising the position, doing the background checks, processing the paperwork, the time and effort that it takes. And if that system is streamlined, even covering some of the costs of the first month's salary. Again, we know this isn't going to be a panacea, but we think it's going to make, it's going to make a difference, and it's certainly going to send the signal to our childcare workforce that they matter and that we care about them and we know how important they are. So with that, again, thank you for your flexibility with the timing. Thank you for your support in our childcare industry and this priority, and would urge a favorable report.
Next, Fatima Whitmore for 2 minutes, please.
Thank you again. My name is Fatima Whitmore, representing SEIU Local 500. I am here again. We are in support of this bill, HB 1100. Childcare providers and employees have been called the workforce that takes care of the workforce. Please treat us that way. There is no doubt that the value that brings family across Maryland, especially during COVID-19, providers have done it. However, while providing care to the childcare children that we serve, we have substantially experienced financial struggles. HB 1100 will provide childcare providers and their employees with a modest bonus of $1,000. That would be a positive first step in recognizing our sacrifice that we do and serve with families every day. The COVID-19 pandemic has accelerated this loss of providers, and between the fiscal years of 2020 and 2021, there were fewer than 751 providers. Now that number has increased. We are trying to save our industry. We are trying to save our workers. Throughout it all, in November 2021, 44% of our programs have reported a 97% of registered providers. These are providers who are licensed childcare providers. This industry has experienced a workforce shortage that we are desperately trying to stop. HB 1100 would relieve the childcare providers and employees by allowing providers to attract credentialed employees and to counteroffer the workforce shortage that we experience now. Childcare scholarship programs simultaneously supporting parents and the workforce. This childcare legislation will tremendously help our children and our families. Again, we ask you that you support this bill. Thank you.
Thank you. Next, for 2 minutes, please, Imani Angela Rose.
Thank you, Madam Chair. Again, I'm Imani Angela Rose. I'm a child care owner and director in Baltimore City. I just want to say we asked for a favorable report on House Bill 1100. Even before the pandemic, childcare has been a profession that has low wages for many of our staff that work in childcare. We would like to show, as Delegate Solomon said, appreciation and support for the workers that we have that remained through COVID-19 to help be the backbone of the workforce and the first responders for people to have places for their children to come safely. And we want to support and appreciate them. And we also do want to encourage and want more people to be interested in coming into the world of childcare. We don't just do it for the money, we do it because we love the children, but these initiatives and incentives will help us to make the profession more likable to many out there in the community. So we do ask for a very favorable report for House Bill HB 1100. Thank you.
Carolina Reyes, please, for 2 minutes.
Okay, it is me again, Carolina Reyes from Arco Iris Bilingual Children's Center. As a director of the Child Care Center, I asked for affordable support of HB 110. The childcare community is more than thankful to know that senators and delegates from our dear Maryland have put so much interest in our advocacy efforts and testimonies from the everyday struggles we encounter, particularly during this pandemic. HB 1100 will provide a great opportunity to help us cover hiring expenses and hiring bonuses to attract people to our field, but also, and most importantly, to award and recognize the amazing professionals that love what they do because they believe strongly that education of small children starting at birth is relevant for the successful leaders of our future. The childcare professional has been serving our Maryland children, and these bonuses and awards will somehow let them know that their job matters. So thank you so much for the opportunity, and I ask for affordable.
Brianna January, please, for 2 minutes.
Thanks again, committee. Brianna January here with the Maryland Association of Counties, this time in strong support of HB 1100. This bill would support licensed childcare providers in our communities and would aid in the hiring and retention of childcare staff, as you've heard, at a time when the childcare community and county resources that support them are really pushed to their brink. During the pandemic, counties were creative in addressing the issue of childcare by partnering with local nonprofits, for example, or even departments of rec and parks, and by offering resources to the communities that they serve. However, these efforts, and this isn't the first time that you'll hear me say this, committee, these efforts cannot replace that which the state is able to provide the childcare community. And we all agree that reliable and safe childcare is critical for the success of Maryland's families and our communities. And counties see the state support offered by this bill as a welcomed resource to stabilize and strengthen the childcare community. And so for those reasons, MACO supports HB 1100 and urges a favorable report. Thank you.
Thank you. Next, Laura Wheeldryer for 2 minutes, please.
Thank you so much. Laura Wheeldryer from Maryland Family Network again. And Madam Chair, I'd like to offer a hearty me too. HB 1100 is part of an important child care package, and you all are to be congratulated on your leadership on this critical issue. Delegates Solomon, Ebersol, and Queen have worked really closely hand in hand with the child care and early childhood community, and we thank you. We urge a favorable report, not just on HB 1100, but the whole package, which is so sorely needed. Thank you.
Thank you. Next, Rebecca Hancock, please, for 2 minutes.
Good afternoon. Once again, this is Rebecca Hancock on behalf of the Maryland State Family Child Care Association. I would like to agree with my co-educators, co-providers, that we are thankful that HB 1100 will provide incentive bonuses for a 2-year period to assist in hiring and retention of qualified candidates in the child care field. We appreciate the committee working on this, and we ask for a favorable report for HB 1100.
Next, Christina Push for 2 minutes, please.
Yeah, thank you so much. Christina Push, Executive Director of the Maryland State Child Care Association. I echo the Me Too's, and I appreciate all of the work of Delegate Solomon and the legislature on these child care package bills. Child care industry is facing critical workforce shortages, needs investments, and HB 1100 provides the necessary supports and the first steps for these bonuses and rewards for essential child care professionals and educators working in the field, as they are so deserving of this and much more. And for that, MSCC urges a favorable report.
Thank you. Are there any questions from the committee for Delegate Solomon or the panel? Okay, seeing none, thank you all so much for coming to testify and staying here with us. Enjoy your weekend. That concludes the testimony on House Bill 1100, and that concludes the bill hearings for the Ways and Means Committee today. Committee, we are voting. It is 2:32. Come back in 5 minutes and let's knock this out, please. Use the restroom and hop right back on.